Hello, my name is Joy Freedman. I am a stage 3C colorectal cancer survivor, and I really wish we were all together at this event, but I guess this video is going to have to do. I wish I could say it was really nice to meet all of you. Hopefully next year we will have all of this behind us and we will be able to get on with a fantastic conference. A little bit about myself. I was diagnosed at age 46. I was in the best shape of my life. I was actually training for a weightlifting competition at the time. I was experiencing some cramping, some minor stomach pain at first, and I called my doctor who said to go get a CT scan. I did that. I received a phone call that said they saw something to go to the ER right away, which I did. Subsequently got 2 misdiagnoses at the ER, which was either irritable bowel syndrome, and they gave me antibiotics, sent me home, told me to do a liquid diet for a week. Fast forward 4 weeks later rather, I was in unbearable pain still. They finally did a colonoscopy, and the mass was so large they couldn't get past it. To say we were all shocked is an understatement. I had always eaten healthy, organic, and had been physically fit, played basketball as well as weightlifting, and had just always been an athlete. So fast forward, had emergency surgery. 2 days later, I woke up with an ostomy, which they told me I wasn't going to have, but I did. I subsequently had 12 rounds of FOLFOX after that. I then had my ostomy reversal and exploratory surgery a year later, and they declared me pretty much cancer-free. They took out my fallopian tubes and ovaries, which looked suspicious, but they were cancer-free. I was cancer-free until September of 2018 when they found a spot in my sacrum. We were shocked because I had gone almost 3 years, almost 4 years really, but 3 years NED. They did CyberKnife at Hopkins. I'm very, very blessed to be treated at Hopkins and have great doctors and a support system. Did CyberKnife, thought that was the end of it. August of 2019, I was having back pain, and they found another spot in my sacrum. At this point, they said they could do what's called a sacroplasty, which means replacing part of my sacrum on both sides with titanium rod and removing the mass, which they did. They replaced both sides. I had that done October of 2019. And then I had proton radiation for cleanup, which finished February 5th of 2020. Currently, the reason I'm sitting here and not in my office chair is because I am suffering from a radiation fracture from that's what they called it, by the S1 nerve. And so it's pretty painful, but as long as I'm sitting still or laying down, I'm okay. They said 4 to 6 weeks to heal, and that's what I'm doing. So that's a little bit about my story. In between that, though, I chose to become a patient advocate. I was very grateful at diagnosis that I was given the opportunity to have a buddy that could help me through all of my ups and downs and trials and tribulations and questions, so many questions, of course, right? When you're diagnosed with something, your world is upside down. So subsequently, in the last 5 years, I have become an advocate. I sit on the Never Too Young board for the Colorectal Cancer Alliance, which I'm extremely proud of. I have also attained my patient Navigator certification, so I can help others to become more educated and to become an advocate for themselves. Through this journey, one of the things I realized the most is that we have to advocate for ourselves, right? The medical system is stressed, it's strained to the max, and this COVID-19 really puts a huge light on that, right? I mean, COVID-19 is happening while so many people are going through treatment and are being diagnosed every day with different diseases, including colorectal cancer. And the strain that it has on our system is just intolerable. So becoming your own advocate, becoming educated on what your options are, getting a second, third, fourth opinion if you need it is crucial. So for me, becoming a patient navigator was all about being able to help others when they're in need or when they're low and when they don't feel like they can relate, to access care, to access other people for care, where to go for social services, where to go for resources, where to go should they need any type of care or transportation or medication that their particular pharmacy can't get. There are other options out there, and there are phone services, and there's so many things that are available to patients that most don't know about, and most don't really know how to advocate for themselves. If they hear no to a particular treatment or approval for therapy, they will accept that no, as opposed to going back and asking or requesting. Example being my proton therapy was turned down 3 different times before I got an approval, and I would not give up with my doctor, going back and forth with the insurance company. We finally did get it approved, but it took a while. And most people are not either equipped for that, or they're just not aware that they can do that. And it's unfortunate that we have a system that is set up in some ways rigged against us and not for us, because of how the insurance companies work and how most of us have to navigate through that. And really, navigating your paperwork is a full-time job. I think you could ask any survivor, any patient, getting their EOBs and getting their paperwork and understanding what's covered and what isn't, and how much is a copay and how much is your maximum deductible. I mean, that's a science in and of itself that most doctors don't even want to look at that, right? So being able to understand that and to educate others who have gone, who are just becoming diagnosed, really fills me. It helps me to know that I can help somebody else. And if my advocacy or my awareness or what I'm educating can save a mother, a father, a sister, a brother, a son, a daughter, I mean, that makes it all worth it, right? To be able to educate others so they can understand what their symptoms are and what their risks are and what they may not have known or thought about with family history or hereditary issues. One of the other things that I'm extraordinarily passionate about is educating young doctors and healthcare providers who are just coming up. I recently did an interview with Johns Hopkins Carey School of Business about that, about educating young professionals that they will see. It was a video series that these young healthcare professionals and doctors will see about early onset colorectal cancer and what the symptoms are, and that it's not an old man's disease, and that so many young people are being diagnosed and being misdiagnosed over and over and over again, and the same things are happening that happened 20 years ago. That's a travesty. It's a travesty in our healthcare education system that these young doctors aren't being told, look, this is a deadly cancer and it is on the rise, and it is on the rise fast with young people. So much so that it's becoming a pediatric cancer now, which was unheard of, I don't know, 20 years ago. So being able to tell these young doctors, look, if you get somebody in there with these symptoms, don't dismiss them. Order the colonoscopy or order one of the other tests that are available that they can get that can mimic the colonoscopy, and then order the colonoscopy if it's necessary, if it comes out. But fighting for us as patients, right? For us to be able to have doctors listen to us, to have nurses listen to us, and to have other people who are our peers listen to us about colorectal cancer is so very important. Because if we don't speak, the message isn't heard, right? It takes two. It takes someone to speak the message and someone to hear the message, right? And not just hear, but listen. And if we can accomplish young doctors and health professionals that are actually listening to us as patients, the ones who are actually going through it, and telling them over and over again how our stories are impacting everyone else, and our stories have such an impact on who they will treat next, right? Because who they're treating could be somebody very young We know that there was a 14-year-old just diagnosed who's part of the Colorectal Cancer Alliance now, and that just should never happen. It should never happen. But that doctor heard them and ordered the colonoscopy and found what they found. So that's part of the reason I do what I do. I do advocacy. I adore it. I love it. And I'm hoping to do so much more of it in the future to let everyone know that if I can get it, you can get it. And nobody wants to be diagnosed with colorectal cancer. It is an insidious disease. It doesn't just affect the colon. It affects almost every part of your anatomy should it not be contained, right? We know it spreads to lung, it can spread to liver. Mine is in my sacrum. It can go anywhere. And so colorectal cancer has to be stopped, and it has to be stopped within our lifetime. Thank all of you for the work that you do. Thank you so much for being part of this conference. And I really hope next year we all get to be in the same space and share this information. I think what is going on here is phenomenal. The more we can educate, the more that we can create understanding around the world, and we can get some really good common treatments and protocols out there, the better we all are, and one step closer to ending this disease. Thank you all for giving me the time to speak, and I really look forward to meeting and seeing all of you next year. Stay healthy, stay safe, stay home, and that is all. Thank you so very much.